Bismillahirrahmanirrahim. Bismillahi wassalatu wassalamu ala Rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh to the Hajj Health Matters webinar brought to you by the British Islamic Medical Association, along with the Muslim Council of Britain, the UK Health Security Agency, and CBH UK. I'd also like to thank the MCB, the Health Security Agency, and CBH UK in allowing us to put this presentation together and put this webinar on today. So my name is Dr. Mohammed. I am a member of the British Islamic Medical Association, and the Hajj Health Matters is part of our Hajj Incubators program, and we aim to improve the health of the Hujjaj who are going for Hajj. This will be done by providing seminars prior to leaving. Inshallah, later we'll be able to help with our Saudi counterparts during the Hajj period, and we'll also be doing a post-Hajj data collection, which we'll discuss later on. And inshallah, if some of us on the call were able to go for Hajj in 2024, and we'll be reflecting on our experiences there. وَأَتِمُّوا الْحَجَّ وَالْأُمْرَةَ لِلَّهِ وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ. So I start with these two phrases from the Quran. Firstly, complete the Hajj and Umrah for Allah subhanahu wa ta'ala. Labbaik Allahumma labbaik, which means, here I am, O Allah, here I am. Secondly, do not throw yourselves with your own hands into destruction. So I picked these two ayats in particular because one reminds us for who we do this Hajj for. This Hajj is solely for Allah subhanahu wa ta'ala, and we are presenting ourselves for Him. And secondly, our health we take onto our own hands, which means we've got to look after ourselves to be able to complete the rituals of Hajj so that we can complete the Hajj to the best of our ability and also have a Hajj accepted as Hajj Mabrur. Just a disclaimer that the information provided is general information for healthy adults and should not be taken as personalized medical advice. Please do take caution, especially if you have a medical condition, and speak to your clinician for an individualized plan. Any opinions that are presented are our own and not of Beamer's. So there will be a lot that we'll be covering today, and inshallah, at the end of the session, we will have time for a Q&A where our panelists will join us to answer any questions you may have. On the panel, we are fortunate to have Professor Shames Ladani from the UK Health Safety Agency, Dr. Tayyaba Mohammed, an anesthetic from London, and also Brother Rashid Mongradia from CBH UK. We'll all introduce everyone throughout the webinar. So many people will have been on Hajj Talks already, but today we'll only be focusing in and around the health about going for Saudi Arabia and around the health during the Hajj days. So firstly, I'd like to invite Brother Rashid Mughrabi. Brother Rashid is from CBH UK. CBH UK started in 2006 after concerns over the welfare of the British Hujjaj in 2005. Since then, CBH UK has been a founding member of the British Government Hajj Task Force in 2012, and more recently, the All-Party Parliamentary Group on Hajj and Umrah in 2018. We are fortunate to have Brother Rashid to share some of his experiences in getting ready for the Hajj and be able to reflect on his journey throughout with CBH UK and with Nusuk and the Hajj Council. Brother Rashid, over to you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Muhammad. And first and foremost, I want to praise Allah subhanahu wa ta'ala for giving us this ability to be of service to the Hujjaj. And we send our salutations upon our beloved Prophet Muhammad, peace be upon him. Where do I start? Hajj is such a topic that if you were to get me fired, which probably need a few hours, but I'm conscious that we've got some very, very good speakers here and a dedicated team who's going to talk you through the health. I'm no doctor, but I've been passionately involved in setting up CBH UK Council of British Hajis since 2006, when I actually saw the work of British doctors on the field in Hajj, the previous Hajj, the first Hajj I did in 2005. Inspired by that, we wanted to disseminate the information, the learnings to all the Hujjaj. And with the help of the late Lord Patel, may Allah forgive him and raise his ranks, um,
Mm.
and his support, we did a tremendous work in raising the awareness around health, safety, and getting people ready for Hajj before departures. Alhamdulillah, more recently, only a few weeks ago, we sat across the table with His Excellency, the Minister for Hajj, Dr. Tawfiq Arabia, talking about the concerns, talking about the quota, talking about everything that you can think about relating to Hajj and Umrah, affecting British pilgrims. And you're right, we set up the all-party parliamentary group in 2018 now to channel that kind of linkage with our Saudi government, the Saudi Ministry for Hajj as well. But more importantly, for us, our dedication and passion is getting the right information over for the Hujjaj and getting them ready. And the last few weeks have been hosting various webinars in terms of getting ready for, the spiritual element, how to perform Hajj, and also the health webinars, and then this one as well. And it's very important that we support these initiatives. And I'm very pleased that MCB, BEMA, the UK security agencies and others, health agencies and others are passionately delivering this message, because there is a lot of worry around the health, because without your health, you don't have that Hajj experience, and we want to make sure you get the best experience. That's my short intro. I'm going to jump onto my slides, if I may. And as Dr. Mohammed mentioned, if you do have any questions, do use the chat, and we can also take the questions at the end of the session as well, so we can have a smooth running of the webinar. So just let me know when you can see my screen. Yeah, is that coming through?
Yeah, we can see a screen, Zaka.
And is that on full screen?
It is now, yeah.
Okay, brilliant. So I'm going to cover the pre-departures, what to pack, and the support that's available for the Hujjaj. Before I start, I want to make it very clear, and especially for those pilgrims who have yet to book, who didn't get a chance to book, or looking to go for Hajj in the future, that if you're a British passport holder and from a citizen from another 125 other countries, then the only way you can go for Hajj is through the official portal, government portal, the Saudi government portal, which is Nusuk Hajj. And you need to start planning 12 months ahead now. So you're at a good time now. In a few months' time, they'll start opening registrations for 2026. And that's the only way you can go for Hajj. So be careful when you go and when you've been presented, especially at this late stage, by a package or guaranteed package, because you will lose money. We see this year after year, people being duped by unscrupulous agents. I thought I'd just use this opportunity just to raise the awareness that this is the only way we can go for Hajj now. If you're a dual national, that's a different story. You can contact us and we'll guide you through there. So an alert and a fraudulent alert from us, from Nusuk, from all the authorities, including the City of London Police, that be careful, especially when you're transferring money and registering for Hajj. Hajj for 2025 has closed. It closed around Ramadan this year. There's no chance of people going for Hajj. And we're aware that people who've got dual citizenships or dual passports are struggling to go as well through Pakistan. That's another matter. But for British pilgrims, the system is closed and you can't go for Hajj now. But you can get ready for Hajj next year. For those who have already booked, and inshallah, our first flights will be departing in the coming days. the following advice is for you. So health requirements for Hajj 2025. I'm not going to go into details. We've got our medical experts with us, but in essence, meningitis ACWY is a mandatory requirement for Hajj. You're going to need that injection at least 10 days before departure. And also, you'll need to present your certificate of vaccination at departures, but you'll also be checked on arrivals into the kingdom as well, whether it's Medina Airport or Jeddah Airport. And we see year after year tears at the airport because people, A, didn't know, allegedly, or weren't sure. On the other, they forget the certificate when they get to the airport. So please don't be one of them pilgrims. Recommended to have other immunizations, so seek advice through your GP. If you've got existing illness, chronic illnesses, etc., go and see your GP, get tailored advice from them, and make sure they do also understand what Hajj is and the kind of physical demand that Hajj will take, so they can give you the proper health advice. And finally, if you're on medication, take some extra in case of delays in your travel as well. But again, with medication, there's some medication that is not available in the kingdom. So consult your doctor, make sure you've got all your prescription, etc., to take with you. So if you are on existing conditions, or if you have medical conditions, get a GP's letter, take a supply of medication, as I mentioned, take a repeat prescription form because it contains all your medication history, and keep medication in your hand luggage and not your checked-in luggage. If you're in serious conditions, then do take your hospital name, consultant name, and possibly even your history, your medical history with you. Ultimately, you are responsible for managing your own health conditions unless your Hajj service provider has guaranteed or has made concessions for you. Moving on, advice from the Ministry of Hajj there, carry your medical history. But one thing I do want to mention to you, that as part of your Hajj visa or your Hajj package, medical insurance is included, which offers you free medical healthcare services in the kingdom. These are Saudi government clinics and hospitals as well. All you need to do is just turn up and they'll see you through. You will need to present your Nusuk card, as you all probably have heard about, and you'll be issued that on arrival. Some early preparation advice that we tend to give. If you've got dental issues, deal with them beforehand. Spectacles or sunglasses, take an extra spare pair. Avoid contact lenses in travel. Take wheelchair, walking aids if you need that. Folding chairs can be bought in Saudi, and they're relatively cheap. Sun umbrellas, very, very important. Take one from here if you can, but you can buy them from there, but make sure they're UV protected, not just the rain umbrellas that we tend to buy here. You do need some UV protection. In terms of clothing, wear loose, light-colored clothing, loose-fitted clothing, and sunscreen. Make sure you take some, and that is unscented, especially in the state of Ihram. For those with mobility issues or will need mobility, there's various different options now available in Masjid al-Haram to perform Umrah, the Tawaf or the Sa'i. You can have manual wheelchairs. You can pick up these go-karts as well. All of this information is available on the Saudi government website, Saudi Ministry of Hajj website. You can contact us for more details as well. Some more tips, especially in the climate that we're going to be experiencing. We hit nearly 49 degrees last year, and it was very, very hot. In fact, we got alerts onto our mobiles not to go out in the peak, especially during 11 a.m. and then 3 p.m. as well. So exercise caution, given that some of the rituals that we'll be performing, we may be walking between different religious sites. So it's always good to carry umbrella, drink lots of fluids, water especially, and just exercise caution at all times and stay in the shade as much as you can. What to pack? If you can scan that QR code, we have a list that we can share. Otherwise, we'll share with you post this webinar via Beamer, inshallah. It's not an extensive list. It's got a list of everything that you will need. you may need to ask or you may want to ask your service provider for items that they will be providing, so you're not duplicating things to take. But just for the hand luggage, just very short tips. Travel documents. If you're going as a family, carry each other's travel documents as well in case you lose your package. Passport copies, etc. Extra pair of clothes. Take a power bank. Very, very important, especially for the days of Hajj. Take an unlocked mobile phone for obvious reasons. Communications critical. You can pick up SIM cards from there. And we'll also be launching some solutions as well through CBH UK and Hajj Guides, which we'll share in our various groups. Money and valuables, keep locked and keep, secure them. Hajj and Umrah books. My advice is just take one or two that you're going to read, as opposed to taking a volume or a catalog of different books that you've been reading up until this point, because ultimately you're only going to need that one, and you'll have guides with you as well. Just to reiterate, medication, prescription, doctor's letters as well. Most importantly, snacks. If you are going to Makkah first, then you also need to pack your ihram and flip-flops. We always put this into our slides. You are responsible for your own luggage. No one else will be, so don't rely on others to look after it. Make sure your luggage is loaded onto buses, onto your flight, etc., etc. What I do find useful with luggage is these GPS air tags. So if you can pick some of them up, drop them in, and it'll give you peace of mind to know where your luggage is. Some very, very important documents that you'll need pre-departure or at departures at check-in. Your passport, obviously, with a minimum 6 months validity on your return date. Check that your passport number matches your Hajj visa, as you will have all done by now. I think majority of people now will have had their Hajj visa. Take a copy of your Hajj visa, a copy of your airline ticket, most importantly, meningitis ACWI certificate. Your Nusuk card is your official identity to perform Hajj. Wear it at all times. You'll be given it on arrival in the kingdom. A tip here again, carry a photocopy of your passport and a photocopy of your Hajj visa in the absence of your Nusuk card until you're issued one, or if you've misplaced it, wherever. At least you've got a proof of ID. You will be stopped, you will be checked to see that you are an official Haji performing Hajj. Anyone thinking about performing Hajj on a tourist visa, business visa, a visitor visa, EVW, please don't. There's a big crackdown this year. Not only will you be risking your life, you are taking the space of those who have actually paid for their services and space in Hajj as well. And we see the consequences of people who have unfortunately turned up, whether on their own doing or they've been duped into packages where they don't have services. There's problems in transportation, accommodation, etc., etc., and they can cost you a life, your life. If you want to learn more about Nusuk Hajj, if you go to the Nusuk Hajj website, there's a 7-minute documentary. You can see what we did a couple of years ago with Nusuk. Furthermore, Hajj on ITVX, that was covered a couple of years ago as well. And it literally takes you through the Hajj journey post-COVID under the new Nusuk system as well. You might see my cameo in that documentary as well. For further support, join our WhatsApp and Telegram groups. Link is there. For Nusuk support, you should all know this number by now, or at least save it. And if you don't know, you can go to the Nusuk website as well, Nusuk Hajj. Some very important numbers here. The Red Crescent number is 977, police 999 or 911. Nusuk Hajj. It's important to get your number or get the number of your Hajj guide, so you're in constant communication with them, and that of your service provider as well. In case you need consular services, if you lost your travel document, if there's a death, etc., then you may need to contact the British consulate. The number's there as well. We do have direct links with them as well, so if you can't get through, you can contact us and we'll put you in touch as well. Some more QR codes as well. You can contact us or follow us on our socials at CBH UK and at Hajj Guides. And that's my presentation done. Like I say, I'll take questions right at the end. If you've got questions in the meantime, please do feel free to put it in the question, in the Q&A. I'll try and answer them throughout as well. Thank you very much. And I'm just going to stop sharing my screen.
Tackle Brother Rashid, that was very informative. Just a couple of things to reiterate about packing. I would definitely recommend checking with your provider as to what is available for yourselves. We saw many people overpack last year, especially during the Hajj days, and then they were having to carry 3, 4 rucksacks on them in, near 50 degrees heat, which is just more or less can become impossible after a while. The Nusuk cards, again, very important to keep them on you. From my experience last year, I was stopped multiple times. One of them being when I didn't actually have my card on me and my phone was on 1%. I had just shaven my head on just after having done the pelting, and the police were there ready, asking for everyone's information, asking for kind of your providers, your Nusuk card. Luckily, someone had a portable charger able to charge my phone. And if you've downloaded the Nusuk app on your phone, then the Hajj identity card also comes on there. So he was able to scan it and then let me go. I think the crackdown is getting a lot more stronger this year, and it will continue to do so for the years coming. So why is Hajj important? Why is your health during Hajj important, and how does your health impact Hajj? Hajj in itself is physically demanding. It's only 4 or 5 days. However, there is a lot of walking to do. It can be crowded at certain areas and certain times. When you're pelting, you can be shoulder to shoulders at certain times during the day. When you're doing your tawaf, you'll be shoulder to shoulder with someone else during the day. The heat and the climate in Saudi Arabia is something that many people will not have experienced before, especially if you're going for the first time. Some of you will go early, will get into a routine, and that routine will be different during the Hajj days. Others will leave the UK, will go there and be doing Hajj straight away, where they won't have time to acclimatize to the climate there. Many people will have a reduced appetite, A, from traveling, B, because they don't want to use the bathroom as much, so we'll try and eat small and safe foods. And your sleep will be disturbed. You'll be used to sleeping in the hot climate during the afternoons. However, you're staying up to do your prayers. You then go to Muzdalifah where, the lights are bright. You can hear the coaches horning all night long and you're struggling to sleep. And all of these things will impact. And if you are not 100% or as 100% as you can be before you leave and before you do Hajj, then these small things and these things put together can make you feel quite ill during the days of Hajj. Prior to 2024, there were certain diseases that they saw kind of through their hospitals. One of them being cardiovascular disease. So anything like heart attacks and strokes. And that was about a third of all of the admissions. About a quarter of the admissions were due to heat stroke related symptoms and dehydration. And about 15% were due to kind of respiratory issues like asthma and COPD and other viral illnesses. And 30% making up kind of falls, trips, sprains, etc. Many of you will have seen in the news last year, around 1,300 people who passed away and their deaths were kind of linked to heat stroke, overcrowding, and malnutrition during those days. And that is something which, even though yes, your time of death is written, there are expectations for us to do what is within our ability to make sure that we are looking after our own health. And we'll talk through heat stroke and the symptoms and how to deal with this as well. So guidance for healthcare professionals and guides. When we were putting this together, myself and Dr. Tayyaba, who were there last year, we looked at what advice could we give to doctors, dentists, nurses, pharmacists who are going for Hajj. And we realize that actually you're in a very similar boat to everybody else who isn't a healthcare professional with a few exceptions. When you're trying to treat someone with heat stroke in the middle of Al-Kaaba Road in Azizia, you don't have the ability to get cannulas to take a temperature, measure blood glucose. You have to rely on your basic first aid knowledge and common sense, trying to look for shade, for example. So, what can we do prior to leaving? One is being prepared. Know your basic first aid, know your medicine, prioritize preventative measures, be proactive within your group. Take a second to speak to the others in your group. Ensure that others are aware of things that they can do to improve their health during Hajj. Understand where the facilities are and which facilities can treat what kind of illnesses and at which hospitals you can get free healthcare as well. Keep a well-stocked first aid kit from everything from a glucogel, some plasters, bandages, etc. It doesn't need to be a complicated first aid kit, even a simple one that you can buy from Amazon or the pharmacists. And finally, as always, it's very important to understand your limitations and understanding that when you are there, for example, when you're stoning the devil, somebody gets hit at the back of the head. Realistically, what can you do at the side without the ability to suture or glue something together? It's about stemming the blood flow. It's about getting help from the relevant authorities whilst you are there and understand where and what you can do. We talked about kind of the physical demand of Hajj, and this is just to give a kind of slight explanation as to what kind of demands you'll have. Between the hotel and the Kaaba, you're looking at anything between 500 plus meters, with the new Voco Hotel being over a mile away, for example. And this can be anything between 15 minutes to over an hour. And journeys which would normally take 2, 3 minutes outside of the Hajj season, on the days of Hajj can take, 15, 20, 25, 30 minutes because there is no flow. The tawaf of the Kaaba, if you're close to the Kaaba, alhamdulillah, for 100 meters, but the further away you are, the distance can be up to 4 kilometers. And just because you're closer to the Kaaba at 400 meters doesn't necessarily mean that your tawaf will be easier. Sometimes due to the crowding, due to how slow the movements are, people that can end up slightly pushing as well, that can take a lot longer to do compared to being on the edge. Say this is more of a fixed distance, it's just under 3 kilometers. And your distances between Makkah to Mina, to Arafah, to Muzdalifah, back to Mina, generally, unless you are planning to do a walking Hajj, transport by coach or by train is provided. For those who are walking, the distances can take anywhere from 1 to 5 hours, depending on how fast you walk and where you're walking to. It's important to note that from Mina to Jamirat, and then from Jamirat back to Mina, from Jamirat to at least until the main roads, those distances you will all have to walk. Depending on where your tent is, this can be anywhere between half a kilometer to 3 kilometers. Generally, the UK tent tends to be after the India, Pakistan, Indonesia tents and can be towards the back of Mina. So there can be a lot of walking to do on those days. I'd like to now call upon Dr. Tayyiba Mohammed to continue with the medical aspects of Hajj and how to treat them. Dr. Tayyiba is currently a resident anaesthetist trainee in London. She completed an undergraduate program at the University College of London and the academic foundation program in ICE intensive care in Birmingham. She has been volunteered for Charity Week throughout university and then has been part of BEMA as long as running the ACE induction program for a few years. She, alhamdulillah, has also joined our Hajj incubators group to share her expertise and was also on Hajj in 2024 as well. Over to you, Dr. Yaba.
Jazakallah for that introduction, Mohammed. I'm really glad I get to be here with you all. Alhamdulillah for this opportunity, and I hope that all of you get a little bit of something beneficial. For the doctors in the audience, some of this will actually just be a bit about first aid and some revision because it's not stuff that we do day to day, actually. And for those of you who are non-medical, then this is just basic advice so you can help others in your group and take care of yourself. So as Dr. Muhammad said, your feet are going to be well used during Hajj. We both experienced that. And so those who are most at risk of getting foot injuries are especially those who are diabetic or have vascular disease in their feet. Inshallah, those who have those conditions already know. And you can get checked by a podiatrist before you go. And sometimes diabetics won't be aware that they've injured their feet. So for everyone, it's advised to just keep checking around for injuries because you don't want those to get worse. Some other advice that we highly recommend before you go for Hajj is don't just go and buy some new slippers, especially for the men who are wearing ihram, who have specific footwear requirements. Don't buy new footwear and keep it nice and clean in your suitcase before you come for Hajj. Please break them in long before you've come, because otherwise those areas where it's going to rub is really going to cause a problem in the heat. The combination of the heat, the amount of steps you're doing, and the sweating is really not pleasant for anyone. If you were to get footwear that is rubbing, then you can always apply some anti-chafing cream, which we will go through. And you should also bring some blister plasters along with you. During Hajj, we advise to keep your feet dry, which shouldn't be too difficult unless you're wearing footwear that's not breathable. So I do advise wearing breathable footwear. If you do find that you do have injuries, you've got to try and keep them clean and try and avoid making the injury worse. And apply anti-chafing cream to areas that rub. General advice for blister care, don't pop blisters. If they do pop, just keep the wound clean and then go from there. Move on to the next slide. So this is for the women. So menstruation and Hajj is quite complicated. The Islamic Academy of Coventry has created this publication on Women's Hajj Companion, which gives lots of advice about various things during Hajj, including praying in Jamaat, because not some women won't be used to that as well. So if you want to scan that QR code, that's a link to the free document for the Women's Hajj Companion, which is incredibly useful, and I use that during my Hajj as well. So for the women who are of a menstruating age, getting your period whilst you're in the farz bits of Hajj is incredibly complicated, very stressful, and ideally avoided. So for all women, we advise you track your cycle from now. Most of us have smartphones. Most of us can upload that data. So it should be able to estimate when you're due to bleed. If you then calculate, which it will guide you in this Women Hajj Companion book as well, if you calculate that there is a chance of you bleeding, then it would be advisable. It's not recommended by the ulama, but it is advisable then to take medication to prevent yourself from bleeding. So you can do that now by going to your GP, explaining the situation, and you can ask for this pill, the tablets that I've listed at the top is called northisterone. And so you can bring that with you. And for women who are pregnant, it's advisable to tell your group that you're with that you're pregnant because you may have difficulties and they'd be better able to advise you if you were pregnant. In terms of things to bring with you in part of your packing list, so bring the pills for delaying your period or whatever contraceptive method you're planning on using, and to just bring your women's health items. So this is my most important advice. If you just go back, Mohammed. So this is our most important advice. So when we say take a medicine 3 times a day, that's what it will say on the box. 3 times a day does not mean breakfast, lunch, and dinner. 3 times a day means taking it every 8 hours. So my advice is during the days of Hajj, your schedule is going to be completely off. So I would advise that you set your first alarm for tahajjud time, okay? So for the time before Fajr. Then that should mean that in 8 hours, it's around Zohar time. So you can take your next pill. And then in 8 hours, it should be around Isha time. Okay. You want to make sure you're taking it in a timely manner. Coordinate with the other friends around you to make sure that you are taking it in a timely manner. If you were to start bleeding at the wrong time, then you can go to the Saudi pharmacies. They can give you a medicine called tranexamic acid, but ultimately, once bleeding has started, it's incredibly hard to make it stop, virtually impossible. And then you'll have to go through and talk to the ulama and the scholars about what's the next steps for you to be able to complete your Hajj. This is a once in a lifetime journey, so don't let improper planning take that away from you, okay? And like I said, please inform your guides of pregnancy. If you are pregnant, bring your antenatal vitamins with you. So that's your B12, your folic acid, or any other medicine that your antenatal care team has told you to take. Please tell them that you're pregnant. There is a chance of miscarrying. This is a highly exertional event that you're going to go on. So please tell your guides that if you're coming and you are pregnant. So, communicable diseases is something we're all aware of. When we go for Umrah, when we go for Hajj, these are very crowded environments. So, I'm not going to talk about vaccines because we have a much more qualified speaker to talk about that. But we are going to talk about other communicable diseases. So, I've got a picture of a man getting a haircut. So, men, you are going to get your heads shaved. With razors that have been used on multiple people, there is a risk of getting blood-borne viruses like hepatitis. So generally, what I saw last year is that you will see them take out a new razor from a packet. So you need to make sure that you're going to reputable barbers and that you're seeing them get a new razor to avoid yourself the risk of you getting those lifelong infections, some of which are not curable, okay? You will be in crowded environments, so there is a chance of getting the Hajj cough, the Hajj cold. It's most people will get it. I got it when we came back. Most of you will get it by the end of having Hajj, but you want to just try and delay that so that at least you're healthy for the days of Hajj. Okay, so to prevent that, ideally bring some vitamin C with you. I don't know if it's placebo. Technically, it's not true, but it is an antioxidant, and for some people swear by the fact that vitamin C will help you keep your immune system healthy. Choose the right kind of foods again to keep your immune system healthy, and give yourself plenty of sleep because that will also help your immune system. Whatever helps you feel good when you have a cold when you're in the UK, bring that with you. So if you take Lemsip when you've got a sore throat, bring the Lemsip with you. If you like to take those cold and flu max tablets to just dry up the secretions, bring it with you because I promise you, you will probably get a cold just because of the environment that you're in. And that's okay. Just bring the things with you that will help you to feel stronger and better. And I do advise that you do try and bring a mask with you on your way back. There are some rules about covering your face whilst you're in Ihram during Hajj. So again, ask your ulama about that. But on the way back is generally when people start to feel unwell when they're out of Ihram. So I would advise you to bring masks for those journeys. So now I would like to invite our very accomplished Professor Shamaz Ladani, who is a pediatric infectious disease consultant at St. George's University Hospital, where he is also a professor who teaches in infectious diseases. He is a clinical epidemiologist for the UK Health and Safety Authority, where he is the national lead for preventable diseases, including Haemophilus influenza and Neisseria meningitis. So if I could hand over to Professor Ladani.
Hi, thank you very much for the opportunity to talk to this group. Can I just check that you can see me?
Yep, we can see you.
And can you see my slides and can you hear me okay?
Yes, we can see your slides and we can hear you.
Okay, I'm going to keep my talk very short, and the simple reason for that is the slides I made, I've been locked out of my account, so I can't get hold of it. So I'm going to try and use the slides that I had made before to try and tell you a little bit about the vaccine and why it's important. The big thing that you have heard about is meningitis and the vaccine against meningitis, but it's not done because and they want you to get vaccinated or because they think that it's a good thing to do when you travel to the Hajj or the Umrah. It's because this is one of the most fatal diseases that we know of for mankind. So meningococcal disease is a very severe infection caused by a bacteria called Neisseria meningitidis, or we commonly call it the meningococcus. And the red two blobs that you see on the red are what the bacteria look like under a microscope. Now, generally, this bug sits in around 10% of people at the back of their nose and their throat, and it doesn't cause any illness, and they're completely fine living with the bacteria with no problems at all. But sometimes, and very rarely, it can cause very severe disease, which typically manifests as meningitis or septicemia. And I don't, there is a reason why I'm putting such aggressive photographs to try and show you that if you get this disease, it's very hard of it to come out of this disease completely healthy. You see that little boy who has got septicemia, which is blood poisoning, and he's got this terrible rash, which is especially affecting his legs, as you can see, and he's most likely to lose his limbs through amputation because there's just not enough blood supply to the legs, and that is a well-known consequence of septicemia or blood poisoning. And then on the right, you have meningitis, which is an infection of the lining of the brain, which can leave you very severely disabled, including with epilepsy and blindness and deafness. So I want to point out these are very, very rare infections, but when they do occur, they are very severe. Around 10% of the people who get meningococcal disease will die of their infection, and usually that will occur within 24 hours of the first symptoms, which may just be a simple cough or a cold or a runny nose or a headache, very mild symptoms, but then will progress very rapidly. Of those who survive the infection, one in three of them will have severe lifelong disabilities, as I have mentioned. And so, even if you do survive the infection, the long-term complications are very, very severe. Now, there are 12 known strains of meningococcus that we know of, and 6 cause disease. And of these, there is a very, very effective vaccine, more than 99% effective vaccine against the ACWY strains. And you will keep hearing the ACWY vaccine. Sometimes it's a ACW135Y vaccine. It doesn't really matter. At the end of the day, it's a vaccine that protects against 4 of the major strains that cause meningitis. And the reason that these 4 strains are actually mandatory is because these different strains cause different diseases in different parts of the world. And the one that is typically associated with the Hajj or the Umrah is part of the ACWY strain. It's the W bit of the ACWY vaccine that we are particularly concerned about. And the reason we're concerned about meningococcal disease is that when the people carry them around their noses and the back of their throat, when you go into a big group, such as a pilgrimage, for example, you're going to meet a lot of people at airports. You're going to meet them inside aeroplanes, and you're going to meet them while during prayers as well. And it's this large group of people who are very, very close to each other that allows this bacteria to move from one person to another person. And the other person might start carrying the bacteria, which is okay. But sometimes they can get very, very sick with those bacteria, and they can get meningitis and septicemia. And the last thing you want to do is get that while you're traveling or even when you come back home. Now, the reason we are having this conversation today is since 2024, so about a year and a half ago, we started seeing an increase in cases of W disease in pilgrims who were returning for Umrah. And this wasn't just in the UK, but many countries in Europe started seeing cases, as well as North America and other parts of the world where the pilgrims were returning to. None of these cases that we know of had been vaccinated with the ACWY vaccine, which goes to show you how good this vaccine is, because you hardly ever see a case in a vaccinated person. Now, cases have also been reported in household members of pilgrims. So it's not only the pilgrims who are at risk, but when they come home, they can pass the infection to other members of their family. And we've seen very young kids who get very sick with this infection after they get it from the person who has traveled for pilgrimage. Now, the other thing that has been mentioned a couple of times already in the talk is that the ACWY vaccine is mandatory for Hajj. If you do not get vaccinated, there is a very, very good chance that you will not be allowed to enter the country, and therefore you will not be allowed to perform Hajj. They are taking this very seriously. They're taking it even more seriously now because of the large outbreaks that we're seeing in different parts of the world, and they do not want the pilgrimage to be responsible for the spreading of this terrible infection to different parts of the world. It's important to remember that the vaccination will protect not only the pilgrims, but also their family members when they come home and their community, because when they come home, they will go to mosques and other areas of prayers, and they could infect others in those areas, and also the wider community in places where they live. The current recommendations are that the ACWY vaccine should be taken at least 10 days before and no later than 5 days before reaching the pilgrimage sites in Saudi Arabia. But the general recommendations are, if you are thinking of going to Saudi Arabia, whether it's for Hajj, whether it's for Umrah, or even if it is for business or holiday, it would be very wise to get the ACWY vaccine at least 10 days before you travel. And this is a general recommendation that goes beyond the Hajj, and it's really important to try and get the vaccine from your GP or your local travel centers. And I'm emphasizing this point is that if you do not get vaccinated, you may not be allowed to perform Hajj by the Kingdom of Saudi Arabia. So just to finish off, my last advice is be vigilant of the symptoms and signs of meningococcal disease, even when you return home, in yourself and in your family members. And if you are not well when you return from Hajj, please seek medical help as soon as possible. And these are just a few websites where you can get more information about the disease and the vaccine. Thank you.
Thank you very much for that, Dr. Ladani. So this is from Dr. Ladani himself that I found on Google. Next slide, Mohammed. So this is another, so stomach issues are common during Hajj. You can get both, it can be infectious, it could be non-infectious. So before Hajj, I do advise to bring some Imodium and to bring some electrolytes with you. And during Hajj, the most important thing is for hand hygiene. It's sunnah to wash your hands before and after you eat, so we highly recommend you do that. I advise you bring some fragrance-free soap because whilst you're in Ihram, it's generally advised to avoid strong fragrances. And if you are going to bring food, make sure it's food that's either shelf stable or that you're storing it properly. There's no guarantee you're going to have fridges in all of your rooms, particularly not when you're in Mina and Azizia. So it's best to just bring food that doesn't need storage in a refrigerator. And if you are going to go out to get food, just make sure you go to trusted food suppliers. In terms of Imodium for the non-medical, if you suspect you have an infectious cause of your diarrhea, it's generally advised not to take Imodium. It's better to just let it run through. But during Hajj, you may not always have the easiest access to bathrooms, and if it's whilst you're traveling as well, then you can take it as a temporary measure. But generally, if it's proven not to be infectious, then it's best to just let it run through and try and avoid contact with others and giving it to other people. That picture on the side is my cartoon of electrolytes. Electrolytes are so helpful. We'll go over why they're also helpful in our next conditions. So these are the non-communicable diseases now. So these are the common things that you'll experience because of the environment that you're in during Hajj. So as Rashid mentioned, the high temperatures, especially in the seasons that we're going for Hajj in the last few years, means that there are more and more people who are at risk of having heat exhaustion and heat stroke. So heat exhaustion is the less severe version, basically, which is where during the high temperatures, one might feel like they've got a headache. They're just feeling weaker than usual. I saw it actually in my father-in-law, who is older. So we tried to go out for Jumu'at, and it had just rained. It was when the Saudi government had made an announcement, so no one was allowed to leave between 11 and 3. So lots of people were leaving after 3 p.m. because it was so hot that day. As soon as we walked outside, just droplets of sweat. So you'll see excessive sweating. You'll have cramping in the muscles because your electrolytes are becoming imbalanced, and you're just really, really hot. So the advice, if that's what you're experiencing, is to stop what you're doing. Move to a cool place. Give your body time to recalibrate. Stay hydrated and try and drink cool water and try and stay cool. So staying cool could be spraying yourself with the water and fan. You'll see all sorts of clever fan technology, often from AliExpress. You could also bring these cool packs that they sell in Boots and Superdrug for migraines. You can bring those with you, and they're quite helpful if you do find yourself out in the heat. And just try and place them on places where you feel strong pulses. So that could be your forehead, your neck, your groins, or under your armpits. If it becomes more serious, then we call that heat stroke. That's where your body has gotten so hot that the center in your brain that controls your temperature is no longer regulating, and all of the enzymes that make your body work are overheated, basically. Then this becomes very serious, and so the person would complain of feeling they'd be sleepier, they'd be more confused, they just look more unwell. If that's happening, then they need urgent medical attention. It's not something you're going to be able to fix at the bedside. So you still need to move them to a cool place and do the simple things that you can do. But ultimately, they need help from the Saudi authorities. So what you can do whilst you're waiting, you can call for help by calling for the Saudi ambulance. So here we've got the ambulance service, which is 997. There's also the Red Crescent Authority, which is 977. Or you can call your guides for help, who'll know how to access health advice as well. What you can do is put them into recovery position, which is what that picture is on the side. So just imagine if you were sleeping on your side, how you would position yourself. And the reason we do that is if they're unconscious, they're not able to protect their breathing tube. So if they were to vomit, then at least it will run out of their mouth and it's not going to go into their lungs, because if it went into their lungs, that would kill them. So you can do that whilst you wait in a cool place and whilst you wait for help to arrive. Prevention, as we said, is better than cure. So as I said, generally it's best to avoid going out at the midday heat because that is when it's hottest. You can get UV reflecting umbrellas. I do not do well in the heat. I did bring one. I think it was from an Australian company because they obviously experience more heat than us. And it was fantastic because it's like walking around with your own mobile shade. They were heavy, but I still recommend it for those of you who are more sensitive to heat. And they're more effective than just using a light colored umbrella. It has a foil in it and it will reflect the UV rays. You need to drink water to replace the lost fluid. You will be sweating excessively as you go out in the heat, and that's a good sign. It means your body is trying to cool itself down, but you have to replace what you're losing. Try and stick to the shaded areas. The Saudi government are very, very good for creating areas that are cooler. They'll have fans and massive spray misters. They'll have shaded walkways. They have massive air-conditioned tunnels created for Hajj. The infrastructure is amazing. So you just also need to be sensible. Take care of yourself and try and sleep where you can. And like I said, if it is feeling like it's getting too much, it's okay, take a break, especially if you're with older people or more frail people, take a break, give yourself that rest, and then continue doing the rituals. So this is another issue is dehydration. So if you're like me and you have severe anxiety about public bathrooms, then you need to get over it, okay? Because you're going for Hajj, there's lots and lots of people there, and it's really not that bad, actually. So just mentally prepare. I don't know if some of you might have heard of Jamaat. So my sister told me, she's like, just go for Jamaat before you go for Hajj, because then you'll kind of get over that whole shared space thing, because that's really not what you want to be worrying about. We're there to do ibadah. Let that be your first and primary concern. In terms of what to do, what to bring with you, these are the electrolytes I bought. I thought they tasted okay. You will have access to lots of plastic water bottles, so you just stick the tablet in, it will dissolve, and then you've got this electrolyte drink. And I do recommend you also bring the chewable type for if you're not walking around with water and you feel like you do need that extra boost. Often they contain glucose as well, which is good if you're having to deal with low blood sugars. So I recommend bringing both. And then during Hajj, do not try and fluid restrict yourself because you don't want to go to the bathroom, because you don't want to break your wudu. Okay, it's not worth it. It's really easy to go to the bathroom. It's really easy to make wudu. So please drink water to thirst. An average person is supposed to drink at least 2 liters a day. Whilst you're in that extra heat, you need to drink even more. And you can, caffeine generally does make you wee more. So you want to try and avoid that because it can contribute to you feeling dehydrated. But as I said, it's all a game of mind over matter. I'm sure you guys have the substance to avoid getting dehydrated because it's easily preventable, and don't let that ruin your Hajj. So low blood sugar can happen to anyone, but primarily it will happen to the diabetics. Hopefully they'll be aware that they're having a low blood sugar, but some people are not aware that it's happening. So some of the signs that you might see is that they're shaking, trembling, they look really unwell, they might be sweating a lot, they might be feeling very dizzy, they may collapse. If you feel for their pulse rate, it might be going a bit faster, and they're just not themselves. The easiest things to do is, as I said, if you have those electrolytes that contain glucose, then that's great. You can give them that to chew, and then just give them something sugary. So there were lots of juices available when I was in our time in Mina. So you should be able to get that to them, and just get something that they can quickly fix it. So some people, especially the diabetics, will walk around with these dextro sugar tablets, basically, for if they are feeling low blood sugar. Right, nosebleeds are incredibly common because of the environment. So because the air is so hot, you have lots of little blood supplies in your nose, and those little vessels can get very irritated by the hot, dry air because they're not able to humidify it. So then that can lead to nosebleeds. I do recommend putting a little bit of Vaseline just in the anterior corners of your nostrils. And that's just to stop it from drying out as much. Don't put it all the way up in your nose. It's just for the tips, just to help humidify things. If you do see somebody have a nosebleed, you must ask them to pinch the fleshy part of their nose, not the bony part, because you want to be able to actually put some pressure on the blood vessels. And then ask them to lean forward. We don't want them to swallow that blood, so don't lean backwards, okay? You want them to lean forward, and then they need to keep consistent pressure on it for at least 10 to 20 minutes. If the bleeding hasn't stopped after 20 minutes, then they should go to seek help advice. It's something that can readily be fixed in an A&E because they'll have some of the equipment to just kind of burn off those little blood vessels that are bleeding, and it can easily be fixed. But generally, if you're just giving that good first aid advice, most of them should get better by themselves. And as I said, prevention is better than cure. So just try and put some Vaseline if you are feeling like your nose is getting dry, and it will feel like it's getting dry, or use a mask if you're not in haram and it's not a problem, because that will also help humidify the air. So skin irritation is also common. So especially the men, you'll be in a haram, you'll be wearing towels and there'll be nothing in between your thighs. So there can be some rubbing. Sometimes you get advised to use Vaseline, but actually Vaseline mixed with the sweat can get really sticky and it's not very nice. So there are specialist creams that are anti-chafing. And so this is one of them. It's called Lanacane. It's probably the most popular one. And this one also has some numbing medicine in it. So what it does is it's kind of a silicone, so it will just help the skin to glide with less friction, basically. This is also what I recommend for if you're feeling like your shoes are rubbing, because it just basically reduces the amount of friction, so it should stop you from getting blisters and stop you from getting any kind of annoying rashes from the skin rubbing. So I'm going to hand over now to Dr. Mohammed, and he's going to talk to you about where to go for help for if you do need it during Hajj. You're still on mute, Mohammed?
You know, I thought after all the COVID years of being on Zoom and stuff, I get used to it, but I still do this every time I'm on a video call. So where to go for help? Alhamdulillah, the services are available, are plentiful. You just need to know where to access this. In Mecca, you have Al-Ajid hospital, which is near the Safa Towers, and that's probably one of the closest hospitals to the masjid. And in Medina, you'll have Al Ansar Hospital as well. If you ask any of your Hajj guides, if you ask your Saudi service provider guides and helpers, if you ask any of the volunteers and workers of the Haram Sharif, they'll be able to point out the services and which one is best, which one you'll be able to get medical attention at. It's very important to reiterate that you should try and aim to go to one of the government hospitals if possible and avoid going to the private hospitals, as your healthcare will be covered in the government hospitals. There are clinics in both masjids, and these are run by the Saudi Red Crescent Authority. Alhamdulillah, I had a nosebleed whilst in Medina, and one of the workers who saw me trying to make a beeline for the exit pointed me to the opposite direction where a Red Crescent member helped put some pressure on and stop the bleeding. The Red Crescent in Mecca normally have a base just next to the Darut Tawheed Hotel, and they tend to have a small porter cabin with their buggies, etc. there, and they tend to be very useful, very friendly, and very accessible as well. There are numerous pharmacies in and around Saudi Arabia. The thing to remember for these is just like the UK for antibiotics and other prescriptions, you do need a prescription for this. The general advice is from the UK is that we don't give antibiotics as a precautionary use. So the advice would be not to take them from the UK. Rather, if you do require antibiotics to be seen in one of the clinics and then have a prescription that can be taken to the pharmacies. The pharmacies will also supply a lot of the first aid kit. They have simple over-the-counter medications as well that can be brought. And they can also be used as a calling point as to where next to go if they can't help with the condition that you have. Healthcare in and around the days of Mina, Arafat, Muzdalifah is slightly different. So in Mina, there are a few major hospitals which have been highlighted here. The Saudi National Hospital on the left-hand side last year was probably one of the busiest hospitals there because a lot of the people that were affected by heat stroke were taken to this hospital. This is normally a quieter hospital because Azizia, that area isn't used as much outside of the Hajj and Ramzan period. And unfortunately, the number of people that were using the hospital did overwhelm the hospital. On top of that, the UK tents last year used to have a male and female clinic run by the International Hospital from Jeddah and would have doctors, nursing staff in both the male section and the female section. These staff would, work shifts and they would actually follow you through to Arafat and to Muzdalifah and then back to Mina. It's just about finding these people. And if you ask any of the volunteers who are there from Saudi, they will point you to the direction, they will give them a phone call, they'll bring you into an office if you're far from the hospital and bring the clinician to you. They are very useful. They are used to treating infectious diseases. They are used to treating trauma. They are used to treating majority of the diseases that we have talked about. Just to summarize on some pointers that we thought would be quite useful towards the end. One, make sure you have a first aid kit between the group. So if there's a few of us going, have one kitted out first aid kit and know who's carrying this. Medications, make sure you are taking it in the original box and have doctor's letters which say what the medication is used for, so your common conditions that you suffer from, and what the medication is. I would also recommend that if you're going for 21 days, then to possibly take 2, 3, 4 days extra in case there is any delay in getting home due to any kind of issues with plane rides. Keep good personal hygiene. Cleanliness is half of our iman. If you do kind of wash yourself with water, then make sure you dry areas because wet areas, moist areas are more prone to bacterial infections. Try and get adequate rest and sleep. If you're going to Saudi early and your Hajj days are towards the end of your journey, make sure that you're not overexerting yourself at the beginning so that you'll struggle at the end. You are going for Hajj, and your main purpose of this trip is to complete your Hajj, which is a first requirement. The other first requirements whilst you are there are your Salat 5 times a day. Alhamdulillah, we see this numerous times. People go, they'll go and try and do as many tawafs as they can. They'll try and do as many umrahs as they can. And if you're able to and you're fit and healthy, then alhamdulillah, that's fine. But if you struggle, then take it easy as you have to be prepared to complete your Hajj. What you don't want to do is come back to the UK and say, what if, or regret the time that you had because you were not able to fulfill the time appropriately. Prepare and vaccinate. Prepare for Hajj spiritually, physically, mentally, medically even, and get yourself vaccinated. Carry an emergency contact number card, which can be placed in the cover of your phone. This can have the contact numbers for other family members in Saudi Arabia, family members in the UK, your Hajj guide, and the Saudi guide as well. And I always recommend people to buy the Saudi SIM. eSIMs are great, it's amazing. However, they do rely on internet. When there's 2 million people in a crowded area, internet can be a bit slow and you can't make a direct phone call. If you get the Saudi SIM, then you can make a phone call straight from a Saudi number to a Saudi number. Start walking now if you haven't already, and make sure you walk in the shoes, the flip-flops that you are going to wear whilst in Saudi Arabia. It's very important. Do not take a pair of shoes that you've never worn before and take them out there. Most likely it will lead to blisters, it will lead to irritation, and that will affect your Hajj. Wheelchair use. Don't be embarrassed to use a wheelchair. If you need to use a wheelchair, prepare from either the UK, take a wheelchair with you, or you can buy wheelchairs in majority of their pharmacies and in their shopping centers as well. And know when to seek immediate medical attention. If any medical staff are here and you feel uncomfortable about the situation you are in, resort back to your basics and then call for medical attention. Anyone here who's not medical and comes across any situation, in every medical scenario that we always say, check for danger first. So in this case, it's potentially heat and crowding, etc. Secondly, get help. Before starting anything else, it's always get help. So try and get some help, try and get out of the heat. What you don't want to do is try to stay with a patient in the middle of the road whilst the sun's at its highest point, and you yourself then also get heat stroke and fall ill. One thing to remember about heat is even though the sun is at its highest at 12 and half 12, due to the atmosphere, etc., the day is actually at its warmest at 3 o'clock. So just because the sun has gone down doesn't mean that the temperature is getting any cooler. If anything, the temperature can be warmer at 3 o'clock than it can be at 12, which means that if you set off at 3 o'clock, that will be the most hottest time in the day. Last year, because of the heat, as we mentioned a few times, they closed the pelting between 11 and 4 o'clock. That then meant that at 4 o'clock, a lot of people tried to pelt before Maghrib Salah to fulfill the Sunnah and led to a little bit of crowding, a little bit of difficulties, and people moving slowly in quite hot weather. If that is the case, that you are allowed to pelt after Maghrib, then take that opportunity to go do it when it's quieter and when it's cooler. Fundamentally, you don't want to miss out on one of your farais to try and complete a sunnah or a nafil. It's very, very important that you look after your own health so that you can complete the rituals of Hajj. Soon, inshallah, we'll be releasing the Bima Hajj Health Survey. And inshallah, everyone that has attended will be sending out an email. This is really important because we want to know what conditions are affecting our British Hujjaj and what we can do to A, prepare you for Hajj, and B, prepare the Saudi government for Hajj as well. This way, we can help each other improve the Hujjaj, and it's a form of Sadqa Jariyah as well, in that anything that changes that happen that benefits someone else, the reward does come back to you as well. So I think we'll start with taking questions. I know there are a few on the chat, so we'll start with that. I am a GP, likely the only female medic in the group. Any suggestions for packing your medical equipment, most common health scenarios? I think we have covered majority of that. The one other th equipment that I might add as a GP or as a health professional is potentially a diabetes testing kit if available, especially with the amount of diabetes within our communities. And anyone else want to add to any to
Yeah,
that
I would
question?
agree with that. It's just revising your first aid because, like I said, you're not in the usual resource setting that you're usually in, so it's relying more on your clinical examination. We're going to release some blogs of some of our experiences as well, so you can have a read of those on the BIMA website and then have some lessons from what we learned as well from being doctors. Um, Generally, also, especially amongst the women, most women will come very well prepared. So generally, the group will have the medicines that you're looking for if you ask around as well. So don't put too much pressure on yourself and try not to overpack.
I think the next question would be for Professor Ladani. How long does the ACW vaccine last for? I had the JAG in December 2022.
So there are two types of ACWY vaccines. They're called polysaccharide and conjugate. They're big names, but the polysaccharide just means it's a sugar vaccine, and the conjugate has got a protein in it. And the conjugate is much, much, much better. In this country, we don't use polysaccharide vaccines. So if you got vaccinated in the UK, it is almost certainly the conjugate vaccine, which is much better. That vaccine gives you very long protection, but my understanding is for the Hajj, they need you to revaccinate every 5 years. So if you've had it in the last 5 years, then you should be okay. You shouldn't need vaccination again. You could use the same certificate if the vaccine was done in the UK. If it was done outside the UK, then you probably need to check which vaccine it is and make sure it's not the one that's valid for 3 years. If it is for 3 years, then it will help you till the end of 2022. But after that, you may need it again. But the chances are it's the conjugate vaccine in this country.
Is there any gelatin-free alternatives to Imodium, the ones we purchased have gelatin? So we have found that recently so Imodium does contain gelatin. It's the capsule element of it. There are loperamide tablets you can get from Tesco and Asda. The best thing to do is speak to the pharmacist because they'll have a online website where they can check the ingredients for you. There is permission if there isn't an alternative available that to take Imodium as there isn't an alternative there.
I was just checking because I think I got loperamide from Boots, and that doesn't have gelatin in the capsule. It's made from a lactose capsule, which is milk. So yeah.
Perfect. Which snacks would you recommend? One to go with that won't be melted by the heat. Brother Rashid?
What kind of snacks? I would say try and be healthy, but knowing our community, you're looking at samosas and fry-ups potentially. Anything with the energy. But most importantly, drink lots of water. Stay hydrated. There's lots of fruit. If you can peel it, eat it. That's the kind of advice we tend to give. Um, and the facilities there are second to none. If you'd been for Hajj pre-COVID, that was a different experience. Post-COVID is beyond 5 stars. And this is in Mina, I'm talking about the camps. For many of you, it'll be just a once in a lifetime experience. You won't have a benchmark, but believe you, take my word when I say, the toilet facilities have been improved. And generally it's a very good experience now, inshallah.
I actually
Okay.
think that you probably don't need as many snacks as you think because, alhamdulillah, we have very hospitable hosts. So, yeah, nuts, yeah, things like that aren't going to get ruined by the heat is probably one way to go, but you probably don't need that many snacks.
It's Shimas. Can I also add? We tend to take a lot of fried foods with us, crisps and things like that, and they're very, very salty. So they will make you more thirsty. So if you do take snacks, like just drink loads of fluids because that's far more important than what you eat.
And I think I'd just like to add that actually you can get everything that you want in the supermarkets there. What I would say is if you can pick up a small bag of biscuits, so just any standard biscuits can be three in a packet and keep that in your bag.
Mm.
The reason being is that when you have low blood sugars and you take the high, you take any sweets, any of the glucose tablets, it'll bring your sugar levels back to normal, but those sugars are called fast-acting sugars. It's also important to have a carbohydrate, so something like biscuits that will keep then your sugar levels high for the rest of the day. Like Tayyaba mentioned, and to give an example, last year the hospitality was amazing. In Mina, every kind of row had fridges full of fizzy drinks, fridges full of water and juice, fresh fruit, croissants, instant noodles, and ice cream, which was available 24/7. In Muzdalifah, every 10, 20 meters, there were four polystyrene containers filled with ice with fruit, water, and juice. So this was available in all of the British camps last year. So you will have stuff available. Don't overpack. A lot of people that did it in our group ended up leaving everything behind. Any tips for mental health sufferers that may be in the group?
So I think you'll be there doing ibadah. I think we can all see ibadah as a source of wellness and mindfulness. And so if you're feeling, especially when in Muzdalifah where it does feel like there's less space, there's always places you can go that are a bit quieter with somebody that you trust, and just confide in them and make sure you have that support network that's going with you. And of course, yeah, like if you are feeling like it is getting too much, just try and be open about that. There's everyone around you wants to help you because there's so much barakah in helping the other hajis. So don't hide from it, and it's fine. Just ask somebody if you do feel like it's getting too much, and then try and find that quiet space. They are there. The places are there. It's not. It is crowded, but there are always going to be places you can go that are a bit quieter if you need that space.
Is it okay to wear Crocs? Brother Rashid, hand this one over to you about best footwear to wear.
I'm not going to advocate any brands, but I wear a pair of Crocs. It's probably my third or fourth running with them. Look, invest in a decent pair, and as the doctors mentioned earlier, wear them in. That's the most important thing. We're actually doing a couple of Hajj walks, a weekly one. But if anybody is in Lancashire, Blackburn, Bolton area, join us tomorrow. You can contact us for more details. But generally, try and get your steps in, wear them in, and invest in a decent pair. You know, you're spending thousands of pounds on a package. Don't go for these cheap £1, £2 flip-flops. It'll ruin your Hajj. But actually, just to add, also check, especially for those that are in a state of ihram, that they do comply with the requirements of having certain parts of the foot open as well. So whilst I'm just saying yes, buy a pair, make sure they're ihram compatible as well. And you can check that with your local mufti or a scholar, Islamic scholar.
Jazakumullah. I think the next two questions kind of related and worried about access to toilets and someone that needs to use the toilet frequently. The My experience from the men's side last year was that the toilets in Mina were plentiful. However, when everyone in your tent went to use them just before Fajr time, they do get busy. Just before Zuhr time, just before Maghrib time, for example, those are busy times. However, outside of the times, there are plenty of toilets. We had multiple toilets, about 4 or 5 rows, and they had a shower in them as well. Arafat is a little bit more difficult. However, there were toilets available for men, which, yes, they were busy, especially around Salah times, they were busy, but accessible. In Muzdalifah, the walk is slightly further for bathrooms, and they are available. Again, due to spending not as much time in Muzdalifah, the bathrooms can have a queue, but they tend to be fast moving. The bathrooms last year were generally kept clean. They used to have toilet attendees that would regularly clean the bathrooms as well. And I know people would have quite stories from previous years, but I think this has all changed. And Dr. Eva, from the ladies' side, would you reiterate that, or was there anything you would add about using the toilets and um, how easy access is. I think you're muted.
So they are clean, and actually, there's lots of staff available around that are constantly cleaning. Sometimes you'll see them cleaning between every single person that uses. So it's clean. Please don't let that put you off, and there's plenty available.
Brother Rashid.
I just want to add, in terms of the toilets, they do have dedicated ones for those with disability as well, and they are European toilets. So don't be, yeah, it's not like previous years where we were given the Asian style. So yeah.
Little worried about crowding and fainting. What do you advise in this situation?
So if you if you fainted, sorry, you won't be able to help yourself, but they you can always, whoever's with you can put you into recovery position until you have woken up, and then slowly you can get up. Usually it will be related to a simple faint. So if you slowly get up, drink some water, and just try and just let the blood flow back up to your body, and then you can slowly get up and go back to a place of safety and give yourself some time to rest.
One thing I would add to that one is that if someone's fainted, but they've come around and they're awake and they're talking, I wouldn't rush to get them sat up. Because what you want to do is increase the blood flow to the brain. So actually, I'd lie them down and lift their feet up for a little while, just to improve the blood flow before standing up. If you stand up too quickly, you can take your blood pressure a little while longer to recover, make you feel slightly ill, and then cause you to faint again as well. So if whoever's fainted is awake, fully talking again, then lie them on their back with their legs raised up. If they're not fully talking, they're struggling, then lie them onto their side in the recovery position.
So
Why avoid contact lenses?
we haven't advised to avoid contact lenses. Obviously, you should also bring some glasses as a backup. You can use your contact lenses. I don't see any reason why not.
And the only thing to be careful with is that many people who have not worn contact lenses in that heat, you can get dry eyes. So make sure that you're taking eye drops with you. If the contact lenses are irritating you, then take them out early, because the longer you leave them, the drier they become, the harder they are to take them out. And actually, it's one of the ophthalmology emergencies if you can't take your contact lenses out. Which brand of formulation of rehydration do you recommend most? Can you exceed the recommended daily dose on the pack?
So I don't know which ones you used, but I think I used something called Cisco, which is the picture we had up. I think it was in Costco, so I saw it and bought it. And the chewable one I used, oh, what was it? I think it was called Fast Chew, and I think that's in Holland and Barrett. Do you know which ones you use, Mohammed?
So
They're
for
all the
the
same.
dissolvable tablets, I used high five. Um, and what I would suggest is sometimes they do say use one tablet max once a day in a normal UK condition. When you're in Saudi where it's hotter, you're sweating a lot, you're also losing the electrolytes from your body. So you do need to replace them. So we used to use a company called High Five. The electrolyte market recently has taken a boom. There's IV formulation, Hydrava, there's loads of companies available. They all work the same and they all have the same ingredients inside of them and the same percentage of ingredients when you actually read it. One thing I took were these Sports in Science gels.
Yeah.
These are very sugar gels, which give a very quick 20-minute boost of energy and raise your blood sugar levels. And the other things were these dextrose tablets, similar to many people might remember the old Lucozade tablets like they used to make, which I think they stopped doing now. I couldn't find them, but they're also very good in raising um, your blood sugar. So my general tip were to use kind of 500 ml bottles and put half a tablet in at a time. Generally, you drink about 4 or 5, then that's equivalent to about 2 to 2.5 tablets. And that is within the limits suggested. can you wear face masks during Hajj? Uh, so Islamically, for men and for women, there can't be anything touching the face. For women that wear niqab, you can wear a hat and suspend in front of you. During your ihram, once you're out of the ihram, then yes, you are allowed to wear a mask. During the ihram, Islamically, you are not. However, if you have an active infection where you're coughing and you're releasing particles and you're feeling unwell, I would ask you to consult. We would recommend wearing the mask and consulting with the ulama about if any compensation needs to be done for this. The reason being is that if you know you have an infection, you're going out and spreading it, that is also not allowed in Islam as well. And it's balancing preventative measures and doing your Hajj. Um, Brother Rashid, anything to add to that one?
No, yeah, I think you've nailed it there. Yeah, prevention better than cure, and also protecting others as well. So yeah, having that balance and make sure you do consult a scholar. There will be a little bit of a compensation, but not as big as you probably think.
So, why should you avoid contact lenses? I think rather than avoiding, just being careful with contact lenses with the heat, with them drying out, like I mentioned earlier. So, with everything, Islam is easy. There are alternatives. Many people get fixed on this is the only way I can do things. There's no veering from this path. There are compensations. There is ability to do things differently. We would recommend consulting with scholars and with healthcare professionals to make sure that you are able to do the Hajj in the most optimum way possible for yourself. Yeah. Any more questions? Just feel free to put in the Q&A or into the chat.
Just to go back to Nadia's question, so my mum has issues where she needs to go to the toilet frequency. What could you advise? So I had similar experience for Hajj last year. As women, unfortunately, you will have to queue for the bathrooms more frequently than the men. So especially that morning that you're leaving for Arafat, there's big queues. So I would advise you wake up earlier than everyone else, if you especially and your mum tell her to wake up earlier than everyone else to go to the bathroom in Mina because there is a long queue. But otherwise, like we said, the toilets are freely available. Just try and plan sensibly, there will be busy times where even moving a little bit takes a long time. So just try and plan sensibly, try and avoid going to the really busy areas because then that could delay her getting to the bathroom.
Any further questions? We're more than happy to answer.
And I wrote it in the group about the umbrella I recommended, but honestly, any trusted UV reflective umbrella is going to be very effective to give you shade. They are heavier than normal umbrellas though, so just bear that in mind.
I would check with kind of the providers as to what's provided. I know some groups were provided with umbrellas last year, and then carrying
Yeah,
two.
that's true. You probably will get given umbrellas by the group that's taking you as well.
If there's no further questions, I'd like to go around the panel and ask for any last words. Just starting from kind of the top of my screen. Professor Ladani, any last words before we close?
No, nothing from my end. It's just, it's we want disease, well, seek medical advice early, so that you can get the right care.
I think you're cutting off a fair bit there.
Can you hear me now?
Yeah, that's better.
Okay, I was just saying that, these are very large crowds and people from all over the world. So do be careful. Like you've heard, if you are not well, make sure that you try and protect others by not passing on the infection. If you become unwell, then, if you're really sick, then make sure you get medical help earlier rather than later. And there's so many people out there, you don't want to leave it late to seek medical advice. And when you come back to the UK and you become unwell, please get yourself checked and don't take any chances. That's all.
Thank you very much. Brother Rashid?
Just to wish everybody a Hajj Mabrur and accepted Hajj, inshallah. These are good tips and advice that we're sharing, but ultimately, this is your Hajj. Embrace it, kill all expectations. You enjoy it. It's a once in a lifetime experience. So the advice is there, is brilliant, but the focus is accepted Hajj. Focus on the ibadah. Remember us in your du'as. Remember the panelists in your du'as. Remember the organizers in the du'as. But most importantly, remember the Ummah in your du'as as well. And inshallah, we'll see you in Arafah as well.
Jazakumullah khair. Dr. Tayyiba?
I'm just reading because Maria Kulsum has asked, are there any other resources we can read up on, and can we access this recording later? So we are hoping to upload the recording to the Bima social media. So that is the plan. In terms of resources, I was just trying to remember the books, and I was just thinking that you'll probably remember the names, Mohammed, of the books that you can use for Hajj in case you hasn't got them.
I think there's a lot, and if you go to any of the Islamic stores, I
Yeah,
think there's Hajj and Umrah Made Easy, and
yeah,
some of
that
them
one.
translated from Urdu as well. The Islamic Tarbiyah Academy from Leicester, Masim Doras, has quite a lot of information. If you Google it, just be careful on who the author is, but majority tend to have Islamic bookstores online will have the Hajj and Umrah books available to you.
Now I just want to say Jazakallah for letting us be part of this, and we hope that you took something beneficial from it. And inshallah, all of your Hajj is your Hajj. All of you stay healthy for your Hajj, and it is accepted. Inshallah.
Jazakumullah khair. Again, just to reiterate, Jazakallah for everyone to attend. Jazakallah for the panelists for giving their insight into this. We pray that your Hajj is accepted. We pray that you are able to make most of your time during the Hajj. Please do remember the panel. Remember each and every one of us that are in this call, and remember the Ummah. From the west to the east, numerous countries where other Muslims are suffering, and in countries where people aren't able to go for Hajj and fulfill their farais as well. So please do remember them all in your du'as. Jazakumullah khair for everyone attending. I pray that this is beneficial. And even if somebody took one thing away from this and that affected them in the Hajj, and or are able to pass any of this information on to anyone else. You don't have to be a doctor to do majority of what we've talked about. And sometimes when you're there in that heat, there isn't much difference between what you can do as a layperson compared to what a doctor can do. So please be aware of what of kind of the stuff that we've talked about. Be aware of your own health needs, and may Allah Ta'ala bless us all in going for Umrah and Hajj, and may Allah Ta'ala accept all of our Hajj as well. Ameen. Jazakumullah khair. And we shall be ending the seminar.